Hello, I'm Michele Bullock, licensed massage therapist in Washington State. I create MBLEx study videos and resources to help you feel confident in passing the massage and bodywork licensing exam. In this video, I'm going to be covering pathologies that you're going to need to know regarding the musculoskeletal system, from strains to structural disorders to frozen shoulder, what they are, their etiology, that means causes, and the considerations that you'll need to keep in mind regarding those pathologies for massage and bodywork. Now, this video is going to become a segment of a larger course that I'm working on building video by video. I'll be posting a couple of them a week until the whole thing is done. And then I'm going to get the course all set up on my website. So for each video, I'm going to have a companion PDF. It'll be an ebook style outline of the content that I'm covering in the video, and then there'll be some worksheets for you to be able to dial in that information, along with some MBLEx style questions at the end of each workbook. So if you look in the description below, if you're looking at this in like September or October, then you'll know that you'll probably just have access to the PDF and not the access to the whole course yet, because I'm still working on building the course. So you look down in the description below and you'll find two links in that case. You'll find one link that will give you access to all of my free and paid stuff. And then you'll find another link that will just give you access to the PDF worksheets for this video. If you look past mid-October in the description below, then you're just going to find the one link and you just follow that, and it will take you to the entire course, and you'll get all the content all at once when you get signed up for that course. So go ahead and look for those resources to help you to be able to dial in this information that I'm presenting to you in this pathology series. So with that housekeeping being covered, we're going to go ahead and get started looking at these pathologies that you need to know for the musculoskeletal system, common conditions that affect movement and function. Use this video to deepen your clinical reasoning and prepare for questions that may appear on the MBLEx. Yes, you will get pathology questions, especially for the musculoskeletal system. So the first thing we're going to start with is talking about cramps and spasms. What are they and how are they different? So muscle cramps and spasms are both involuntary muscle contractions, but they differ slightly in how they are caused and how they present. A cramp is a sudden, intense, and often painful contraction of a muscle that may last from seconds to several minutes. It is usually caused by dehydration, electrolyte imbalance, overuse, or poor circulation. So essentially, not all the correct chemicals are getting to that muscle, which can cause a cramp. And if you're curious about how muscle contractions work, make sure and check out my video on my YouTube channel about muscle contractions, and that's what will give you an idea of what causes a muscle cramp. Now, a spasm is a more generalized or sustained contraction that may be less intense than a cramp, but can still cause discomfort, stiffness, or restricted movement, often seen in response to muscle fatigue, injury, or nerve irritation. So a spasm can look like hypertonicity in a muscle. When you're going to treat someone, it feels like a really, really tight muscle. Often that's when people are saying, like, I have this really tight thing that just won't let go and it's really bothering me. Right? So once the cramp or spasm has passed, the massage and bodywork can be very effective for treating the after effects and for helping to prevent those cramps and spasms from being as intense in the future. When you have a client on the table, there's a chance that the work that you're doing can cause a cramp or spasm, because chemistry is getting mixed up with the metabolic processes that kick up while you're massaging someone or treating someone. I've had it happen many times that someone will ask for deeper work in a specific area, but when I'm doing it, they will tense up because they don't realize that they should be more relaxed through the process. They don't know how to verbalize asking me for less pressure, so they don't tense up. So they'll tense up a different area of the body, which will cause a cramp. That often happens actually in the back. That's where I see it the most often. When I'm working on a different area, they will cramp up back here. It's interesting. So when that is happening, sometimes I'll have them, like if it's in that spot on the back, I'll have them gently contract the antagonist muscle of the muscle that's cramping, which helps to force a reflex to make the muscle that is cramping relax. I don't try to press on that cramping muscle, okay? That's really, really important. Definitely avoid pressure during active cramp or spasm because it can make the pain worse, and you can strain the muscle by putting extra pressure on a muscle that's already pulling really hard on its attachments. Be sure to talk about any kind of underlying causes while still staying in your scope, naturally. Ask them if they've been drinking enough water or if they stretch well. Ask them if they are taking a multivitamin, things like that, without actually sounding like you're prescribing anything. But, just suggest that, sometimes muscles do better if you have access to a multivitamin because of mineral deficiency or something like that. Talk to your doctor, see if you can find out more about what might be causing these spasms. Okay, so we're going to move on to talking generally about sprains and strains and get more into detail. How do I know the difference between a strain and a sprain? Strain is about the tendon or the muscle. So the T in strain means, T for tendon. And a tendon is a part of the muscle, right? So a strain can happen anywhere on the muscle, from the tendon to the belly and the attachments, right? A sprain is an injury to the ligament. So let's first start talking about sprains. Injury to ligaments caused by overstretching or tearing. Symptoms include pain, swelling, and bruising around a joint. Massage and bodywork is contraindicated in the acute phase. That's the case for both strains and sprains. Right after someone has injured themselves is not a good time for a massage, for any kind of treatment on that area. What do? We do RICE or PRICE. That's that protocol for acute injury care. So we do rest, ice, compression, and elevation. Ice for 15 to 20 minutes at a time to reduce the swelling and the pain. Use a bandage to wrap it up. Rest it, elevate it to reduce blood flow and inflammation to the area that is injured. So talking about sprains, there are different grades of sprains. Grade 1 is going to be milder. Grade 2 is going to be a little bit worse, and grade 3 is like a complete ligament tear off. Grade 1 is mild overstretching. That's what you're going to see the most often when someone says, I twisted my ankle a little bit and it hurts. A grade 2 sprain is a partial tear. So that might take several weeks to several months, whereas a grade 1 might take a few days for it to start feeling a little bit better, for the swelling to go down. A grade 2 is going to it could take a couple months. So you know that if it goes beyond a month, you've got a grade 2 sprain. And then a grade 3 sprain is, like I said, much more severe, and it usually requires medical intervention. So if somebody comes in with a puffy foot or a puffy knee, I'd be like, you need to talk to your doctor about this. So usually sprains happen in the wrist, the elbows, the knees, and ankles. We'll see it the most in the ankles and knees. For the knees, we've got the anterior and posterior cruciate ligaments, and the medial and lateral collateral ligaments. That's where you'll see them in the knees. And then in the ankles, it's typically with eversion or inversion that we'll see the sprain. How do we know the difference between a sprain and a strain? It has to do with testing range of motion. Have them move the joint that's in question. Active, it hurts, okay? Could be either a sprain or strain, we know that. And then we have them go completely limp, and then we move the joint for them. It still hurts, right? Then we know there's a pretty good chance that is a ligament sprain. And then if it doesn't hurt when you move the joint passively, and you put some resistance against the movement and have them do the movement, then you know that there's a pretty good chance that that's a tendon. Not diagnosing, but this gives you an idea of how you're going to go about treating that client once they're out of the acute phase. Let's talk about strains a little bit more. Just like sprains, there are the different grades of injury to a strain. So once again, limited range of motion after the acute phase, super important. So grade 1, mild overstretch, microscopic tear. It can happen anywhere on the muscle. So if someone's got a pain in the middle of their leg, it's not likely to be a ligament sprain. It's more likely to be a strain. Grade 2 is a partial tear with pain, swelling, and moderate loss of function. Grade 3 is a complete tear. Severe symptoms, possibly requiring surgery to reattach the tendon. Once again, the types of strains are acute, chronic, or repetitive overuse. Acute, sudden, trauma-induced, and you don't want to be working on that until the inflammation settles down, or if it's really extreme, until you get permission from the physician. A chronic is gradual damage over time. Someone has had trauma repetitively over a long period of time. They've partially healed it and then injured again, partially healed it and injured again, and not gotten any kind of treatment. That can be a chronic strain. And then there's repetitive overuse, where someone's doing something repetitively. Someone's a painter, someone's a pitcher in a baseball team, someone is a runner. So things like that, where they are repetitively doing tiny injuries to that tendon or muscle, that's called a repetitive overuse. Massage and bodywork may be appropriate for sprains and strains when swelling, heat, and sharp pain have subsided, typically after the first 48 to 72 hours. That's in a grade 1 of either of those. Have I dialed that in? I'm dialing that in because I want to make sure that you guys understand that that's what you're going to see the most as massage therapists. So fractures, which is a break in the bone due to trauma, overuse, and disease. That's pain, swelling, bruising, and possibly deformity. Hopefully they won't be coming to you and being like, can you fix this? If it's deformed. If they're like bent their arm. Yeah, that ain't right. Go to the doctor right now. Bodywork's contraindicated until it's fully healed and they have permission from their physician. So I always thought that a fracture was like a really extreme break, but it just turns out that a fracture is just what they call all the breaks. There are compound fractures where there's multiple breaks, so there's that. Facts to know: reducing a fracture is to realign the bone fragments. Fixing a fracture is stabilizing the fracture with hardware, screws and bolts and things like that. Immobilization is using a cast, brace, or splint to prevent movement of the break. So sometimes people who have broken toes, they'll wear a boot, and sometimes they'll just go on without doing, and same thing with fingers. Sometimes they'll brace it, and sometimes they just go on with their lives because they're not doing anything that they need that for. Regarding fractures, I've seen lots of clients that are in the recovery phase after a break, where because of the immobilization of the arm or the leg, their muscles have become shortened and a little bit degenerated from the casting, the immobilization process. So I will help work on lengthening those muscles, re-stimulating those muscles into the neurological process, connecting with them again so that they can get the strength back in those muscles again. Also, trigger points can build up from muscles not being used. So that is something that I have worked with people on as a massage therapist, body worker. So we're going to be talking about different kinds of pathologies that can affect tendons and bursa. We have tendinitis, which is, when we put it together with our medical terminology, itis is inflammation, and then we've got tendon. So inflammation of the tendon, which is the segment of the muscle that's not contractile. Section of the muscle that connects the contractile part to the bone. So it's often from overuse. It's like pulling and pulling and pulling, and little tiny tears happen, and then the inflammation sets in. So avoid deep or direct pressure on a tendon when it is actually inflamed or hot or extremely painful. That's the acute phase. Instead, focus on relieving the tension in the surrounding muscles that may be contributing to the overload. That is compensatory tightness or the synergists and antagonists. So if someone has active tendinitis, let's say for example, in one of their biceps, the short head of the biceps, someone has active tendinitis in there, I'm gonna work on the whole rotator cuff to support that tendinitis. And also, like, they're not using this arm as much, I'm gonna work on the opposite arm because they're gonna be overusing the other arm, which can cause tendinitis in the other arm, as, you know, a cascade of effects of what happens when you have tendinitis on one side. So it can support the tendon if you work on all of the other muscles, because they will be activated or they will be relaxed, which reduces strain on the tendon that is being inflamed. And then once the inflammation has settled down on the tendon, then you can work on some deep friction or trigger point therapy in the tendon area to increase mobility in that tendon, and just make sure and work on all those compensatory structures as well. Tendinosis, meaning chronic condition, chronic pathology, it's a degeneration or breakdown of the tendon tissue. It occurs when the tendons are subjected to excessive repetitive stress, leading to tiny tears and inflammation. So tendinitis can be more short-term, whereas tendinosis is way more long-term, chronic. Same treatment goes for tendinosis as tendinitis. If you're in an acute phase of inflammation, then avoid working directly on that tendon and work on all of the compensatory structures. Tenosynovitis, so itis is the inflammation. Syno is speaking about a synovial sheath going around the tendon. Syno is talking about a synovial sheath. So there are specific structures that will have a synovial sheath around them. A lot of them are in your hands, in your fingers. So we have some, say, de Quervain's tenosynovitis, which I'm going to be talking about, happens in the wrist. So that's where you'll have a special sheet that goes over the tendon to help it slide more smoothly, to help us with our digital use. So with overuse, typically that synovial sheath will become inflamed, which can cause pain, swelling, and stiffness in the area. Bursitis is a little bit different. It doesn't have to do with the tendons. So the last three we were talking about were about tendons, but bursitis has to do with the bursa, which is a fluid sac that lives between the tendon and the bone, which helps, just like a synovial sheath, it helps to protect the tendon from rubbing on the bone too much and causing damage. So I'm pointing to my shoulder because we have bursa in our shoulder, we have bursa in our knees, we have bursa in our hips to protect those repetitively used joints. So don't use direct pressure on that bursa when it is inflamed. So let's talk about the difference between bursitis, arthritis, and tendinitis. Can all seem to have the same kind of symptoms, but specifically I'm going to talk about tendinitis versus bursitis. Both of them are inflammation in a joint area, on the outside of a joint area, not on the inside. Pain location for a tendon can feel like it's linear, following the shape of the tendon, whereas bursitis is more like one specific spot in the tendon. Now, I do want to mention that treatment for bursitis is very similar to treatment for tendinitis, tendinosis, tenosynovitis. Treat all of the surrounding structures, don't put direct pressure on an inflamed bursa. So going back to what we were talking about, the difference between tendinitis and bursitis, pain with motion is an interesting way to differentiate bursitis from tendinitis. With tendinitis, the pain worsens with resisted motion when we're doing resisted range of motion. Specific motion is what irritates the spot. You have them resist you using those muscles and it hurts. Whereas bursitis doesn't hurt worse. It just keeps hurting the same when you use resisted range of motion. But if you touch the spot, it's like, yow, then that means it's the bursa. Using the muscle hurts the tendon. Touching the spot hurts the bursa. So that's a huge way to figure it out. So common sites for tendinitis is going to be the whole rotator cuff, the Achilles heel, the elbow, lateral and medial epicondyle area, or the wrist. Those are common sites for tendinitis, whereas the bursitis is going to be on the top of the shoulder, at the side of the hip, in the back of the elbow, or at the top of the knee in specific spots rather than whole areas. With tendonitis, the swelling of the tendon is going to be mild or no swelling at all. Whereas with bursitis, you can see that it's like hot and puffy. Okay. So in both, avoid direct pressure when they're in the acute phase or in inflammation, and support the surrounding structures. Moving on, a subset of tendonitis would be plantar fasciitis. So the fascia becomes inflamed. So that's specific to the foot, the plantar, the underside of the foot. And it can make the space around the heel, specifically going toward the distal part of the foot, feel hot and irritated and painful. It's common in runners or people who stand for long periods of time, putting strain on the fascia of their feet. So the goal with massage and body work is to release tightness in the calves, which will contribute to tightness in the foot and cause strain in that fascia. So spinal, structural, and inflammatory disorders. We're going to be talking about spondylitis, spondylosis, spondylolisthesis, and disc issues. So spondylitis, spondy is referring to the spine. Makes sense, right? Itis is inflammation. Spondylitis is inflammation of the vertebrae. Avoid massage during active inflammation. And a subset of spondylitis is ankylosing spondylitis. Ankylosing is Greek for to bend, and that means someone has had spondylitis for so long that it's starting to create an additional curvature of the spine, a hunched posture. Body work helps with flexibility, but don't use deep tissue pressure on the inflamed joints. If there's active inflammation, always in your contraindication, don't massage it. Or if you are, keep it really, really, really gentle. So spondylitis and ankylosing spondylitis, when they're not an active acute inflammation, it's okay to give them a decent massage according to their preferences. But when they're in inflammation, then avoid working around those vertebrae. Spondylosis is degeneration of the spine due to aging, typically. There are some conditions that can cause additional spondylosis. Sometimes inflammation can cause spondylosis over time, but the spondylosis isn't about the inflammation. So if someone just has spondylosis, then there isn't really a contraindication to massage as long as they don't have inflammation. And just try to relieve the tension of that spinal degeneration that happens because things get off balance. So, yeah. Spondylolisthesis, see, the spondy part is what made it all so confusing in my head. Spondylitis, spondylosis, spondylolisthesis. It made it all confusing, but that just means spine, 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 spine. Okay? Itis is inflammation. Osis is chronic condition. Listhesis means they've overlapped. They're structurally off. So you've got a vertebrae that goes beep, right? So that's spondylolisthesis. It's slipped. One vertebra slips over another. Whoo, painful. Avoid direct pressure on the spine if someone's suffering from this. So use gentle massage away from the direct spinal area, but try not to, because those muscles are trying to stabilize that spine. Try not to use deep tissue pressure on those areas because you want those muscles to be a little bit contracted in order to continue to support the spine. Disc pathologies. Disc degeneration is the gradual breakdown of the intervertebral discs due to aging, overuse, or injury, reduced disc height, stiffness, and pain, often contributing to conditions like spinal stenosis or spondylosis. Okay? So disc degeneration can lead to spondylosis. That's something to know. Most of us get some degree of disc degeneration over time, like I said, often aging. So I have some of that, of course. That doesn't mean you necessarily have pain. Disc degeneration happens with young people too. Doesn't mean you necessarily have pain. Avoid deep pressure during a flare-up of pain from the disc degeneration or bulging from that degeneration. A herniated disc is when the gel material bulges out, which can cause nerve pain, numbness, tingling in the dermatome or the nerve coming out from where that bulging or herniated disc is. Okay, so yeah, no deep compression, no deep tissue work very near the spine when that is happening. What I do is I'll just like touch them gently. I'll like touch them down the back and be like, this is my first time working on you. I just want to check on how things are with you. How's it feeling? Or if someone has had history of spinal issues, then, or disc degeneration or disc bulging, then I'll be like, how's this going today? Then, it can be on a day by day basis. Sometimes the muscles are not irritated and contracting and the disc bulging gets straightened out. And some days it's a little bit worse. I have had the case of someone that was like, I just gently touched their spine and they jumped off the table. It was so painful. They screamed. That's a person that needs to go talk to their doctor immediately. All right, so watch out for that. Now, a disc or spinal pathology that you're probably going to see way more often is whiplash, which can happen from any kind of sudden acceleration or deceleration that can happen with sports injuries as well as motor vehicle accidents. So it happens in the neck a lot because I've got this heavy head that makes this whoosh, whoosh very easily, but it also can happen from a jerk or a sudden impact to the spine, anywhere on the lumbar area. So with people that have been in car wrecks that have ended up on my table, I have found whiplash symptoms all the way down their spine, thoracic and lumbar, as well as cervical. So when they're in the acute phase, where they're currently experiencing inflammation, avoid massage at all. If they're starting to get, in the weeks afterward and the really intense acute inflammation is settling down, but it's just stiff and slightly painful, then start using gentler techniques, work your way up over the weeks and months, depending on the degree of severity, into deeper tissue massage for the chronic phase. Once you've gotten into that, subacute and chronic, you can work your way up to deeper techniques to help open up any kind of tension that has gotten stuck there. Common joint overuse injuries. Massage can relieve tension but avoid direct pressure during acute symptoms in all overuse and tendinitis situations. Bodywork, which considers the joint movement, its prime mover, synergists, and antagonists help to alleviate pressure on the inflamed joint. Always, when you're working on any kind of tendinitis, consider the whole joint of the muscle that you're working on. So, elbows. We've got lateral epicondylitis. That is your extensors. Lateral epicondylitis are your extensors. Okay? So, irritation of that lateral part of the elbow. Repetitive wrist and arm movements. So pain and tenderness on the outside of the elbow, which can radiate down the forearm. We have medial epicondylitis, which is your flexors, and that's from repetitive wrist flexion and gripping, right? When you grip, you can feel that in the medial part. So tennis elbow or golfer's elbow, it's hard for me to keep the different sports straight. When it comes to that, I'm just like, does it hurt when you do this or does it hurt when you do that? That's how I differentiate it between lateral and medial. So yeah, there's those. And then there's patellofemoral syndrome, which is runner's knee. Pain around or behind the patella, so inside the knee, aching inside the knee or around it. So just like the cap, the knee cap, which is a little different than some of these other things that you can get. Activities like squatting, climbing stairs, prolonged sitting, or runners can get that inflammation. Osgood-Schlatter disease is another knee repetitive stress. Tendinitis causes inflammation at the tibial tuberosity, which is slightly south of the patella. So often triggered by physical activity and most often happens with teenagers. And then we have in the wrist, like I said, de Quervain's tenosynovitis. What did they call that? Finkelstein test? Where you hold your thumb and turn your wrist outward, and if it causes screaming pain, you got de Quervain's tenosynovitis. I most often hear people they're like, oh, it hurts really bad when I pick up my cast iron pan. And I'm like, I know what that is. So all the tendinitises, we know if it's an acute inflammation, we keep it gentle or don't treat that area at all. Instead, we work on all the surrounding structures. And tendinosynovitis is a little bit different when it comes to friction. That doesn't really help very much. If you want to work on anything, it should be down here and not inside the wrist area, but just try to loosen up the muscles going up the arm. But regarding all the other ones that are just tendinitis, then you do all the sequences that you would be doing for tendinitis in general. Oh, but be careful with Osgood Schlatter on adolescents, using deep tissue on growth plates in the legs, because those can become damaged. You don't want to mess with a kid's ability to get nice and big and tall. So yeah, be careful with that. So we're going to talk about the structural alignment of valgus and varus. Valgus is where your knees or the medial malleolus of your ankles would be more pointed together. Sometimes they call that knock knees because the knees are knocking together. That might be something that can help you with valgus, to remember valgus. But I remember valgus because it's like there's gum. So with the elbows, gum is making my elbows stick to my ribs, or gum is making my knees stick together, or gum is making my medial malleolus stick together. So common causes are muscle imbalances like weak glutes, tight adductors, flat feet, or any kind of structural changes. For a valgus alignment where things are pointed inward, your joints are pointed inward, focus on releasing the overactive muscles that are pulling those joints together. So with knock knees, it would be the adductors, any kind of medial knee tension that's pulling that together. And the same thing for the ankles or the arms, like whatever medial structures are pulling that inward. We try to release that and try to stimulate the lateral structures. Definitely refer them to the physical therapist for actual exercises. Stay within your scope. Address any kind of compensatory tension anywhere else in the whole structure for the whole body. So for varus, that's the opposite. I don't have any special tricks to help you remember varus, except that it's the opposite of valgum, which is making those things stick together. So it's the distal segment of a limb deviates toward the midline. If you've got your elbows that stick out more, that means that your hands are going to stick in more. Or if your knees, we call that bow-legged, right? If your knees stick out more, then that means your feet are going to come in more. And the same thing with your ankles. If your ankles are varus, that means that your feet are going to be more inverted. So we call that, bow-legged. Common causes are arthritis, osteoarthritis, structural bone shape can do that, tight lateral structures. For your clients that have the tight lateral structures and it's not any of these other issues like bone shape or arthritis, then you would want to work on your tight lateral tissue, like the IT band or the lateral hamstrings, and reduce compression or stress by improving mobility around the hips and ankles. And be cautious around arthritic joints if arthritis is what's causing that varus alignment. Okay, now we're going to be talking about arthritic conditions. So massage is contraindicated during active flare-ups and inflammation. We know that already. So osteoarthritis is a degenerative joint disease where the cartilage wears down over time, leading to pain and stiffness, and it's most common in weight-bearing joints. Rheumatoid arthritis is an autoimmune disease where the body attacks, where the white blood cells attack the joints. Gout is a form of inflammatory arthritis caused by the buildup of uric acid crystals in the joints. It usually affects the big toe, but it can affect the ankles, knees, or fingers. So symptoms are sudden, intense pain, redness, swelling, and warmth in the affected joint. When your client has any of these arthritic conditions and they are not in active inflammation, then you are free to work on them as they feel comfortable, as they want to be treated. Bunions are where you have a bony protrusion at the base of your big toe caused by a misalignment of the joint, usually due to genetics, poor footwear, or arthritis. The bone sticking out can cause swelling, stiffness, and pain in that affected joint. So it gets worse with pressure activity. You can alleviate some muscle tension surrounding that joint in the big toe to help with discomfort. Postural curvatures, kyphosis and lordosis. We know you have your natural tiny bit of a curve in the thoracic spine, up back, right? But that's a kyphotic curve. So kyphosis is when you have too much. Osis is a pathological condition. So kyphosis is too much curvature, excessive outward curvature of the thoracic spine, caused by poor posture, osteoporosis, congenital factors, causing back pain and muscle tightness. You can treat those overstretched posterior muscles and try to lengthen and open the tight anterior muscles. And then you've got your normal lordotic curve, but lordosis is a pathological overcurve of the lumbar spine. We call that lordosis. So that's an excessive curvature of the low back, and it can cause a lot of pain in the low back. So that can be caused by poor posture, sedentary lifestyle, weak abdominal muscles, obesity. All of those can go together. For treating lordosis, we try to lengthen and relax the hip flexors. Those are the anterior muscles of the hip, which helps to straighten out that pelvic tilt and reduce the curve of the lumbar spine. And then we try to relieve tension in that low back discomfort. Scoliosis is an abnormal lateral curve. So kyphosis is an extra S curve. So we got the normal S, right? So the top of the S would be kyphosis, the bottom of the S would be lordosis, whereas scoliosis is the sideways curve. So it can cause uneven shoulders, low back pain in general on one side, and muscle imbalance. So bodywork and massage can reduce that muscle tension, and it can actually do a lot for scoliosis. Torticollis is an involuntary contraction or spasm of the neck muscles, which can make you slightly sideways. Slightly rotated or slightly, you can have slight rotation or slight lateral flexion. It can be congenital, so little babies can have it, and parents often bring little babies in that have torticollis for a gentle massage to help straighten that tight neck out. It's a general name for somebody who has a neck that's just slightly sideways or slightly tilted. And so gentle massage increases range of motion, blood flow, and relieves tension to try to straighten that neck out. And we have muscular dystrophy. Trophy means progressive muscle weakness or atrophy, degeneration. Defective muscle proteins is what causes it. Symptoms vary depending on the type, but often include difficulty walking, muscle atrophy, loss of mobility over time, loss of muscle use. So massage and bodywork can help improve circulation, reduce muscle tension, and provide relaxation, but the techniques should be gentle to avoid overworking already weak muscles. Muscle atrophy, just like muscular dystrophy, is a loss of muscle mass and strength resulting from disuse, injury, or medical conditions like nerve damage or diseases such as muscular dystrophy. So muscular dystrophy is a defective muscle protein, whereas muscle atrophy is the general term for all of those symptoms. Reduced muscle size, weakness, decreased mobility or function. Massage and bodywork can help improve circulation, reduce stiffness, and maintain flexibility in affected areas, but should be combined with physical therapy and exercise to rebuild muscle strength. Make sure and refer your clients because they need help with those things. Often, muscle atrophy and these structural imbalances that I just listed, lordosis, kyphosis, scoliosis, a lot of the times those things go together, and we don't want to be blaming our clients for not taking care of themselves. We don't want to guilt trip them into doing the work. Guilt never works, but instead just be like, you could probably benefit from specific exercises. If you are certified, give them advice on exercises they can do or refer them. Be like, what, I can give you a referral to a physical therapist that I know if you'd like to know some exercises. Sometimes I just suggest that, you could just always Google exercises that you can do for this area. I would do that if I were you. Don't say you did that on the MBLEx. Because on the MBLEx you refer them. Okay. Miscellaneous conditions. We're getting toward the end, guys. Shin splints. Medial tibial stress syndrome is a shin splint. We're thinking about our shins, that area on the anterior leg between the knee and the ankle. There is like a strip of muscles. Tibialis anterior is the big one. And it's commonly caused by repetitive stress or overuse, particularly in athletes or individuals who suddenly increase physical activity. So if you're like jamming all of a sudden and you're doing repetitive dorsiflexion, it can cause a shin splint. So athletes are the big ones. Massage and bodywork can help alleviate muscle tension in the lower legs, improve circulation, and reduce swelling, but avoid deep pressure during acute pain or inflammation. Compartment syndrome is another lower leg condition. When pressure builds up within one of the muscle compartments of the lower leg. So we have the different muscle compartments. We have the anterior compartment that has all the muscles of the anterior leg. We have the lateral compartment, and that has your fibularis or peroneus muscles. And then we have the posterior compartment. We have the deep compartment, and we have the superficial compartment in the posterior area. If there's like trauma, overuse, or swelling from an injury, it can cause deep aching pain, tightness, numbness, and sometimes visible swelling or shiny skin because the muscles have become so swollen and tight that they're squeezing the nerves and the blood vessels that are going between the feet and the rest of the body. In acute cases, it's a medical emergency that requires immediate surgical intervention because the swelling has gotten so bad that that leg needs to be loosened up. The leg muscles need to be opened up immediately to prevent somebody's feet from losing circulation. So that's super important. In chronic exertional compartment syndrome, symptoms come around due to exercise, but they subside when someone rests. So it's like an inflammation that comes and goes. Massage and body work is contraindicated when there's active swelling happening because compression that you're using on those muscles can make it worse. But when you're not in an acute or inflammatory stage, then you can go ahead and work on that. Always get the clearance from a healthcare provider when someone has a diagnosis of compartment syndrome. Osteomyelitis is a serious bacterial or fungal infection that gets into the bone. I had that when I was a little girl. Caused by open wounds, surgery, or bloodstream infections. Symptoms are localized pain, swelling, redness, fever, and sometimes drainage from the affected area. Massage and body work is contraindicated in all cases of osteomyelitis. You need to have, when someone has had osteomyelitis, clearance from a physician to be able to work on muscles because they've been immobilized is super important. Osteoporosis is a chronic condition of decreased bone density. Osteo is bone, porosis means you're getting some pores in there, like little holes that happen. So the bones become more brittle and susceptible to fractures. It can occur with aging, especially with postmenopausal women because they're not absorbing minerals as well because of hormonal changes. And it causes symptoms like back pain, often get it in their low back. They'll lose height. They get a stooped posture. Massage and body work can help reduce muscle tension from those bones changing shape over time, but avoid deep pressure because you could fracture bones because they're very brittle. Spina bifida is a congenital condition where the spine and spinal cord fail to develop properly, leaving part of the spinal cord exposed or protruding through a gap in the vertebrae. The severity varies, ranging from mild cases, which is just the occulta variation of spina bifida, causing no symptoms at all. I have worked on a few clients that have spina bifida, so they're able to get around and you wouldn't know otherwise that they have the spinal cord coming out because it's not like it's sticking out through the skin. It's just sticking out through the vertebrae. Or more severe forms causing nerve damage, mobility issues, or other complications. Massage and body work can help improve circulation, reduce muscle tension, and address compensatory patterns because often if they have more severe cases that will mess with their gait or how they're able to hold their posture. But be careful to avoid any kind of direct pressure on the spine or any sensitive areas or devices or shunts that are helping to stabilize their spine and spinal cord. Congenital or acquired conditions, let's talk about that when it comes to pathology real quick. Congenital conditions are present at birth. Someone's born with a congenital condition. An acquired condition is something that develops after they're born due to environmental or behavioral factors, injury or infection. Okay, so now you know the difference between congenital and acquired conditions. One last pathology, and then we're done for the day. Frozen shoulder, otherwise known as adhesive capsulitis. You're going to find this a lot more than you know, because just because someone hasn't been diagnosed with it doesn't mean they don't have it. Okay. It's a condition where the shoulder becomes stiff and painful due to inflammation and thickening of the joint capsule. So someone has a chronic issue in the joint capsule for so long that it makes it so that they don't have the full range of motion in that joint. It's interesting that it can develop gradually, or it can happen suddenly, and the person's just not able to use their joint in their shoulder the way that they used to. And it's like, where did that even come from? That's when it happens suddenly. It won't go away. It can go on for years. So I've had lots of clients that have this. When you have a client that's just like, I don't know why I just can't get this range of motion, when you try to get them out of their normal range, or when you try to get them out of their reduced range of motion, sometimes they just can't do it. It's not painful, they just can't do it. So just be like, I wonder if you should ask your physician about frozen shoulder. And then they can get some physical therapy work done on that to try to increase their range of motion again. And yeah, never push them into painful movement. So I go slow, and just see where their limit is. So finally, it's really essential for every body worker to know what all of these pathologies are, to be totally familiar with them, because that's what you're going to be working with, is people's muscles. That's your main job. So it's really important for you to know all of these and get them dialed in so that you can be an effective and safe massage therapist or body worker. So you need to know when you can go forward safely, when you need to make modifications, or when you need to refer your clients out. When you understand these pathologies, your clients are going to trust you more as well, because they'll come to you and say, I've been diagnosed with this or that, and you can be like, okay, I understand how that works. Or they're like, I have pain in this spot, and then you take them through the different types of range of motion patterns, and you can find out more about what that is. And they're like, wow, you've blown me away. I totally trust you now because you know what you're talking about. So make sure and study up on these pathologies and get them dialed in, and that will also help you on the MBLEx. And so watch out for the next video that we have. It's going to be nervous system pathologies. But in the meantime, make sure and get the companion PDF for this video so that you can work on those worksheets and do those practice questions to get yourself prepared for your massage and bodywork licensing exam and know what those things are. You will be tested on a few of these. Okay, with that, toodaloo. See you next time.